Hello, my name is Vanessa Garcia Gonzalez, and today I will be doing the NG tube insertion. So before we begin, we're going to go ahead and confirm our physician orders, which I have done so. And now we're going to go ahead and start by getting all our supplies needed, which will include a cup of water with a straw, my 14 French NG tube, a towel, hand hygiene. I have my pair of gloves, my 60 ml syringe, my specimen collection, a pH test indicator, some tape, pen light, safety pin, lubricating jelly, emesis basin, the basin with some warm water, and tissues in case the patient needs them. And I'm going to take all my supplies and we're going to take them to the patient's room. Knock, knock. Hi, Mr. Smith. I'm coming in. My name's Vanessa. I will be the nurse taking care of you today. Can I please have you confirm your first and last name and your date of birth? Perfect. I have verified with the wristband that I am indeed with the correct patient, and I have provided patient privacy. Oh, also stethoscope is another thing I needed, so I have it right here. Okay, Mr. Smith, the doctor has ordered that we place an NG tube with a continuous suction. And so what that is a tube that goes from your nose all the way down to your stomach. And essentially what it's going to be doing is going to be sucking out all the contents from your stomach. And this is to provide some time for your stomach to properly heal. Okay, any questions for me? Alrighty, so we're going to go ahead and begin. So we're going to go ahead and bring the patient bed up to a comfortable working position for me. And we're going to bring the patient to a high Fowler's position. Okay, and now that I have done so, we're going to go ahead and perform hand hygiene. And we're going to put on our pair of gloves. Sorry, I apologize. I have been practicing. Okay, now that my gloves are on, we're gonna go ahead and place the towel on our patient. And we're gonna place our NG tube into the basin with some warm water. And we're gonna go ahead and get our pen light. And we're gonna go ahead and inspect our patient nares. So what we're gonna go ahead and do is we're gonna make sure that as we're looking, we are ensuring that there is no occlusion obstructions or any abnormal findings. We are also checking the membrane to make sure that they are not red, swollen, or have any aberrations. We are also checking the patient septum to make sure that it is not deviated, so it's midline. And next I'm going to go ahead and check which nostril has better airflow. So I'm going to go ahead and push down, and I'm going to have the patient breathe in and out. Perfect. And now the other one. Perfect. So the left side has better airflow, so we're going to be using that one. And now that we have checked that, we're going to go ahead and measure our NG tube to make sure we get the correct findings. So what we're going to go ahead and do is we're going to measure from the tip we're going to measure from the tip of the nose to the tip of the ear, all the way down to the, all the way down to the xiphoid process, which reads about 50 centimeters. So we're gonna go ahead and add a piece of tape to indicate that we are in the correct location. Sorry, to measure the correct finding, or the limit of which will be here. Okay, and just Mr. Smith, a couple things that you should be aware of as I'm placing the NG tube. I'm gonna have you start off by looking up. So you're gonna go ahead and flex your head for me, and we're gonna insert the tubing, okay? You might start to gag when we reach the oral pharynx. And when you do so, I'm gonna ask that you take you're gonna take a sip of water, and I will insert 2 to 4 inches at a time. So I will guide you when to take sips of waters. If at any point it becomes too much, if at any point you are having any trouble breathing or continuous gagging that you need a moment to take to catch your breath, please raise your hand, and I will go ahead and slow down or give you a moment, okay? I will give you a moment to catch your breath. So now that I have explained that, we're gonna go ahead and begin by lubricating our tubing with our jelly. So the patient has already started looking up for me, and we're gonna go ahead and begin to insert. And as we're inserting, we're gonna go ahead and follow the natural curvature of the tubing. Perfect, so we are inserting, and now my patient has started to gag, which means that we have reached the oral pharynx. So my patient's gonna go ahead and start taking sips of water. So ready? Sip of water, and we're gonna insert 2 to 4 inches. Sip of water, insert 2 to 4 inches. Sip of water, 2 to 4 inches. Sip of water, 2 to 4 inches. Sip of water, 2 to 4 inches. Perfect. So now that we have reached until our markers right here, we're gonna go ahead and kink our tubing, and I'm gonna go ahead and get my syringe, and we're gonna draw up about 5 to 10 mLs of the content, and I have unkinked. I have unkinked in order to draw 5 to 10 mLs. Perfect. We're gonna go ahead and kink again, and we're gonna place the content into our specimen cup, like so. And we're gonna add our test indicator, and the indicator should read between 1 to 5, which it does. And because it reached 1 to 5, we're gonna go ahead and secure our tubing. And we're gonna go ahead and circle around the tubing, and then we're gonna secure it on the nasal bridge, like so. Now we're gonna go ahead and have our X-ray team come in and confirm that we are in the correct location, which they should be seeing the tubing end off in this patient's stomach. They have confirmed, so I'm gonna go ahead and secure the tubing to the patient's nightgown, like so. Perfect. Now that we have secured, I'm gonna go ahead and make sure that our tubing is connected to the continuous suction, that it is not kinked, it is painted, and it is not clamped. Kinked or clamped, sorry. Okay, it is not so. Now I'm gonna go ahead and document what I have done, document my patient's reaction, and document the characteristics of the contents that we have suctioned out, which would include the amount and the characteristics. Alrighty. And I'm also going to go ahead and bring the patient bed down to a low position, lock the bed. I'm going to pick up all my personal belongings and take them with me. And I'm going to go ahead and take off my gloves, perform hand hygiene. All right, is there anything else I could do for you, Mr. Smith? Okay. So like mentioned, I'm going to go ahead and step out and come in and suction whenever the doctor has asked me to, document. And so like mentioned, I will document my finding, which will include the procedure I have done with the patients, the characteristics of the discharge that's in the suction machine, like the amounts, characteristics, and on top of that, how the patient has reacted with this whole thing. Thank you.